Welcome to SAT2 Career 2.0 online nursing channel. There is only 24 hours to give ESI nursing officer exam. Here we are going to discuss 50 most important questions for tomorrow's ESI nursing officer exam selected from previous year question paper. I wish you all the best for tomorrow's exam. Before going to today's video, please subscribe to our channel and please click the bell icon to get the new notification about new videos. Come, let's see the first question of the day. Father of germ theory is A. Newton, B. Virginia Henderson, C. Louis Pasteur, D. Robert Koch. The right answer, Louis Pasteur. Question number 2. In caring for the post-craniotomy patient, which intervention can help to reduce increased intracranial pressure? Option A. Keeping the patient flat in bed. B. Elevating the head of the bed 30 degrees. C. Closely monitoring the IV rate. D. Turning the patient to her or his right side. The best intervention to decrease intracranial pressure will be option B. Elevating the head of the bed to 30 degrees. Question number 3. The nurse is preparing the anxious patient for major surgery and remarks, everyone feels some anxiety, but you will be asleep during the whole thing. This is an example of which communication style? A. Empathy. B. Summarizing. C. False reassurance. D. Premature advice. The right answer is false reassurance. This type of explanation given by the nurse is a false reassurance. Question number 4. Who introduced antiseptic spray during surgery? Option A. Joseph Lister, B. Robert Koch, C. Leeuwenhoek, D. Fleming. The right answer is option A. Joseph Lister. 5. The specific treatment of filariasis is by administration of option A. Diethyl carbamazine, B. Chloroquine, C. Dapsone, D. Carbamazepine. The filariasis specific drug is diethyl carbamazine. Question number 6. The nurse assesses wheezes in a patient with asthma and realizes that these breath sounds result from A. Increased thickness of respiratory secretions, B. Use of accessory muscles of respiration, C. Tachypnea and tachycardia, D. Movement of air through narrowed airways. The right answer is movement of air through narrowed airways causes these breathing sounds. Question number 7. When the young AIDS patient complains of debilitating night sweats, the home health nurse suggests that he go to clinic for option A prescription for antibiotics, B. TB screening, C. Complete blood count, and D is treatment with an aerosol inhalant. So the right answer is option B, TB screening, which is very essential to do for patient with AIDS who is complaining debilitating night sweats. Question number 8. The theophylline blood level is 13 mcg per ml. Which intervention is the most appropriate in light of this finding? Option A. Give the next dose of theophylline as ordered. B. Skip the next dose and then resume. C. Call the charge nurse or physician. D. Take the patient's blood pressure immediately. The right answer is option A. Give the next dose of theophylline as ordered because 5 to 15 mcg per ml is normal blood level of theophylline. Question number 9. The nurse explains that sickle cell crisis occurs when the sickle-shaped red blood cells option A rupture, B produce hemoglobin, C interfere with blood production, D obstruct major arteries. So the sickle cell crisis occurs when this red blood cells sickle shape will obstruct the major arteries. Option D is right. Question number 10. A hospitalized patient has been prescribed dexamethasone for an allergic reaction. The instruction that the patient should be given with discharge teaching relative to this drug is option A. Report blurry vision. B. Check blood sugar level routinely. C. Do not operate heavy machinery. D. Take this medication with meals. Here, dexamethasone taking patient must check the blood sugar level routinely because there is chance for blood sugar level to increase. Question number 11. Increased risk for administration of morphine sulphate to a mother during labor is associated with option A. Increasing the mother's BP, B. Prolonging the bleeding time, C. Depressing the fetal respiratory center, and D is prolonging the second stage of labor. So, increased administration of morphine sulfate can cause neonatal withdrawal syndrome, in which the fetal respiratory center is suppressed. Question number 11, answer is C. Question number 12. The nurse collecting data on the reproductive system from a female patient is told that the patient has a vaginal discharge that is cottage cheesy-like in appearance. The nurse recognizes this as a common sign of option A. Pelvic inflammatory disease, B. Trichomonas vaginalis infection, C. Atopic vaginitis, D. Candida albicans infection. The right answer will be option D. Candida albicans infection, characterized by cottage cheesy discharge. Question number 13. In a burn patient with eschar formation around an entire arm, the nurse will include frequent assessment of option A. Urine output, B. Pain level, C. Capillary refill, and D. Breath sound. So, eschar formation indicates there is a gangrene formation. So, nurse's role is to assess the capillary refill every time. Question number 14. The patient who has been taking opioid medication for postoperative pain exhibits pinpoint pupils. The anatomic portion of the eye that has been affected by the medication is the option A sclera, B retina, C choroid, D bulbar conjunctivitis. The right answer for this question is option C choroid. Choroid is affected due to opioid medication which cause the pinpoint pupils. Next question is, when the nurse reads in the patient's history that the patient has experienced otalgia, the nurse knows that the patient has option A hearing difficulty, B buildup of cerumen, C ear pain, D ringing in ears. The right answer is ear pain. Otalgia means ear pain. Question number 15. The most common cause of epistaxis in elderly is A. Nasal allergy, B. Hypertension, C. Nose picking, D. Injury. Epistaxis in elderly people is due to hypertension. Question number 16. Soft tissue X-ray of the breast is A. Mammoplasty, B. Mammography, C. Mastopexy, and D is cholangiography. The right answer is mammography. Question number 17. Which of the following term is used to describe stone formation in salivary gland? A. Stomatitis, B. Parotitis, C. Silolithiasis, and D. Siloadenitis. The stone formation in the salivary gland is known as silolithiasis. Option C. Question number 18. During labor station, +1 indicates the presenting part is option A high in the false pelvis, B on the perineum, C slightly below the ischial spine, and D is slightly above the ischial spine. +1 indicates the position presenting part is slightly below the ischial spine. Question number 19. The nurse assessing the results of a Rinne's test sees the bone conduction is greater than air conduction. The nurse translates this to mean the patient has option A conductive hear loss, B sensory neural hearing loss, C normal hearing, and D is a cochlear defect. The right answer is when bone conduction is more than air conduction, that indicates the patient is having a conductive hearing loss. Question number 20. Which of these items is an example of a positive stressor? A. Test anxiety, B. Loss of a job, C. Paying a income tax, and D. Single motherhood. The positive stressor among this is Option A, test anxiety. Question number 21. A patient with an alcohol addiction says, my drinking is all my wife's fault. She makes me so crazy, I just have to have a drink. This is an example of A, rationalization, B, denial, C, intellectualization, D, projection. So this statement represents the defense mechanism used by the patient is projection. Question number 22. Chicken pox can sometimes fatal to children who are receiving option A antibiotics, B insulin, C anticonvulsion, D steroids. The right answer is steroids. Chicken pox taking during when the steroids also taken along with chicken pox symptoms is a fatal for children. Question number 23. The nurse is discussing the body's first and second line of defense against infection with a community group. This first line of defense includes which of the following? A. Teeth, B. Sweat, C. White blood cells, and D. T lymphocytes. The first line of defense is sweat. Option B. Question number 24. Ability of the cardiac cells to pass or propagates electric impulses from cell to cell is known as option A. Automaticity, B. Excitability, C. Conductivity, D. Contractility. The passage of electrical impulses from one cell to another cell is called as conductivity. Question number 25. Litchen is the symbiotic association between A. Algae and fungi, B. Fungi and roots of higher plants, C. Bacteria and roots of higher plants, D is algae and bacteria. This is a general knowledge question. Symbiotic association between the lichen, which having the symbiotic association is between the option. Let's see the option. The option is algae and fungi. The right answer is algae and fungi. Question number 26. The primary reason for using prednisone in the treatment of acute leukemia in children is that it is able to option A decrease inflammation, B reduce irradiation edema, C suppress mitosis in lymphocytes, D increase appetite and sense of well-being. The main reason for using prednisone in the treatment of acute leukemia is to suppress mitosis in the lymphocytes, to spread the cells, to control the cell division. Question number 27. All of the following medicines are used in the heart failure except option A digoxin, B enalapril, C heparin sodium, D dopamine. So in heart failure we are not using heparin sodium. It is an anticoagulant. Question number 28. The part of the ear which is responsible for maintaining balance of the body, A. Semilunar canals, B. Cochlea, C. Tympanic membrane, and D. Ocellus. Which part is responsible for maintaining the balance of the body? The right answer is semilunar canals. Question number 29. While communicating with a hearing impaired patient, option A, face the patient when speaking, B, repeat the statement, C, shout, show that patient can hear, D, use a high pitched voice. The right answer is face the patient when speaking with a client who is having hearing impairment. Question number 30. Kernick's sign is a striking feature of option A, meningitis, B. Nephritis, C. Neuritis, D. Dendritis. Kernick's sign is a striking feature of option A. Meningitis. Question number 31. All of the following are side effects of phenytoin except A. Ataxia, B. Hirsutism, C. Hypoglycemia, D is gum hypertrophy. The which is not the side effect of phenytoin. Hypoglycemia is not the side effect of phenytoin. Rather than it causes hyperglycemia. Question number 32. If a child develops cyanosis early during a tonic-clonic seizure, it is most appropriate for the nurse to option A insert an airway, B administer oxygen, option C is use a padded tongue blade, and D is observe without intervening. In the tonic-clonic seizure, the nurse's intervention will be administering oxygen. Note down in the tonic-clonic seizure, the nurse's priority intervention will be administering oxygen for a child who is developing cyanosis. Question number 33. A client at high risk for respiratory failure include those with which of the following diagnosis? Option A, breast cancer; B, cervical sprains; C is fractured hip; and D is Guillain-Barré syndrome. So respiratory failure will be diagnosed by Guillain-Barré syndrome according to this statement. Question number 34. The nurse is caring for an adult admitted with a diagnosis of brain tumor. Shortly after her admission, the client suffers a seizure. The nurse's initial intervention must be directed towards option A, controlling the seizure; B, protecting the client; C, restraining the client; D, reducing the circulation to the brain. So the right answer here is protecting the client. Question number 35. A 82-year-old male client with Parkinson's disease is frequently incontinent of urine. Which of the following intervention is appropriate? A. Diaper the client; B. Apply a condom catheter; C. Insert an indwelling catheter; and D is provide the skin care every 4 hours. So here 82-year-old male needs a condom catheter. Question number 36. Bell's palsy occurs due to the lesion of option A, fifth cranial nerve; B, seventh cranial nerve; C, brachial plexus; D is 12th cranial nerve. So Bell's palsy is due to the lesion in the facial nerve, that is seventh cranial nerve. Question number 37. Which of the following indicators would show if the condition of the client with adult respiratory distress syndrome (ARDS) is improving? Option A, atrial blood gas values; B, bronchoscopy results; C, increased blood pressure; D, sputum culture and sensitivity result. So without doubt you can write down arterial blood gas values shows that the client is improving from the adult respiratory distress syndrome. Question number 38. Treatment of choice for tension pneumothorax is option A, water seal drainage; B, needle drainage; C, suctioning; D, postural drainage. The right answer is needle drainage is needed for relieving the tension pneumothorax. Question number 39. Early form of periodontal disease is A, periodontitis; B, oral cancer; C, gingivitis; D, dental caries. So early form of periodontal disease is option C is gingivitis. This is the earlier form of periodontal disease. Question number 40. Central incisors appears at option A, 6th month; B, 10th month; C, 12th month; D, 4th month. Central incisor usually appears between 6 to 10 months. 6 to 10 months, but basically appears at 6th month. Question number 41. Momentum or the fold peritoneum suspending option A, stomach; B, small intestine; C, large intestine; D, esophagus. The right answer is stomach. Question number 42. Paius patches are found in A, stomach; B, ileum; C, duodenum; D, esophagus. Paius patches are found in ileum. Question number 43. Ineffectual straining at a stool is known as A, borborygmy; B, steatorrhea; C, constipation; D, tenesmus. The right answer is tenesmus is known as ineffectual straining of the stool. Question number 44. Which nursing assessment is important in patient with ascites? A, bowel sounds; B, abdominal girth; C, urine output; D, complete blood count. The right answer is abdominal girth assessment is very essential when the patient is having ascites. Question number 45. Sits bond should not be given to the patient during first 24 hours after hemorrhoidectomy because it may increase the possibility of option A, infection; B, hemorrhage; C, abscess formation; D, delay wound healing. The right answer is given here, B, hemorrhage. Question number 46. Oncotic pressure of plasma is due to option A, albumin; B, prealbumin; C, electrolytes; and D, fibrinogen. Oncotic pressure of plasma is due to the presence of albumin. Question number 47. SWOT analysis refers to option A, strength, weakness, observation, and threat; B, strength, weakness, opportunities, threat; and C, strength, weakness, opportunities, and techniques; and D, strength, weakness, observation, and techniques. SWOT analysis means Option B, strength, weakness, opportunities, threat. Question number 48. Which of the following is the first step in job evaluation? A. Job specification. B. Job assessment. C. Job description. And D is job analysis. The right answer is job analysis is the first step in job evaluation. Question number 49. A survey measuring individuals across a period of time is called A. Longitudinal survey. B. Cross-sectional survey. C. Intervention survey. D. Experimental survey. So long time period assessment, the survey is done on individual is known as longitudinal survey. Question number 50. Select the pair which has the same relationship as the pair of iodine goiter. A. Mangonemia. B. Insulin diabetes. C. Hormones cancer. And D is fat obesity. The right answer is given here. Insulin diabetes has the same relation like iodine and goiter. I wish you all a very good luck for giving this ESI and Safdarjung exam tomorrow and on Thursday. Thanks for watching this video. Thanks for your support. Please subscribe to Satu Career 2.0 online nursing channel. If you like this video, please like and give the comment. Also, if you want to see these two videos, please click that and you can watch. Thank you. Bye bye.